Thank you, Chairman. Thank you, gentlemen, for being here. I'd like to follow up on the questions regarding the faculty contract. Last year at the appropriations hearings, the system told the committee that they were able to negotiate some significant work rule changes with the AFSCME employees, of which contract we were dealing with at that point. And I'm going to quote directly from the transcript: "The net cost of the AFSCME contract per employee over the life of the contract is a little more than $600, which is quite modest." I would agree that is quite modest. Was it possible through work rule changes that you were able to make with the faculty contract? Can you give me an example of that? Were you able to do that, and how does it compare to the AFSCME contract and costs?
A couple things. First of all, we still need to ratify the contract, but we're still working on those numbers as we look at those, as we look at not only our projections in distance ed, other areas, as well as the health care, all of those pieces. We're still running through those numbers in terms of, in fact, we've just provided worksheets to the universities to sort of project through those. Plus, a key provision was the voluntary retirement incentive program that faculty, upon ratification, that senior faculty eligible for retirement may take advantage of, and that skews our costs. So if you could give me a little time, I'll get back to you with a specific number and impact on that one, but we're still running those numbers.
That would be wonderful. If you could provide that to the chairman, then the entire committee would have that. You mentioned the retirement incentive. Do you have any idea, any estimation of what that might save the system? Was there any feelers out there for who may or may not be willing to take that before you started talking about that?
What we can do is to make a series of sort of actuarial assumptions based on age, years of service, and typically the Commonwealth, and not well before we even got looking at this thing, sort of views individuals as retirement eligible from the notion of the 25 years of service that then nets you into the health care program and that kind of thing. Now, if that hits an individual who's 52, they're less likely to jump out than someone who might be 63 on that one. So we have some. We certainly have looked at it a number of ways. We know who might be in the zone for that kind of thing, but each individual makes their own choice on that one. That's why I'm hesitant to sort of give numbers on, we anticipate X hundred of people or generating how many millions in salary savings. We need some time to have that work through. We're going to be on a very quick process in terms of identifying those individuals, identifying themselves to us so that we can be prepared for next budget cycle on that one. And so when all that comes together, we'll be happy to make a report to the committee.
Thank you. We look forward to that. Thank you, Mr. Chairman.
Thank you.